If you have a primary family member with celiac disease, then probably the children that come from that situation should be tested for it?
Yes, there is a antibody test, but there's also a gene test, a DR8 and a DR2 gene profile test.
Having those genes guarantees you a celiac disease,
No.
or more probably have celiac disease?
Gene plus environment, so it increases your chances of having it. You can't have it without the genes, but you have to have some kind of something in the environment to trigger it.
So if you had those genes, you're at risk of having the disease. If you don't have those genes, that means you're not going to get the disease?
Less than 1% chance.
So it reduces it by 99%.
Yeah.
Because there's probably another gene we haven't found to add to the picture anyway. Okay, if you're going to make a diagnosis, what would be the best lab test for a doctor to draw to at least make the diagnosis? What would be the ones you would consider?
If you were doing a blood test in your office, there are two blood tests, the tissue transglutaminase and the endomysial antibodies. In order to do a tissue transglutaminase IgA level, you have to make sure that they're not IgA deficient. So
if they have IgA deficient, the test won't show anything.
Test won't show anything. So tissue transglutaminase and a serum IgA level. Also, some labs don't do endomysial antibodies. They'll do tissue transglutaminase, but endomysial antibodies, IgA and IgG, are also specific.
So the person's IgA deficient,
Yes.
What would be the ideal test?
A biopsy. If you suspect, well, there are the IgG tests. There's a tissue transglutaminase